I'll be moderating our discussion today, and I'm joined by my two colleagues and experts in the field of disaster management. This is Dr. Erin Hughey, our Director of Global Operations at PDC. She is an expert in the use of applied science and information to support evidence-based decision-making. I'm also joined by my colleague, Mohammed Fadli, who is an expert in the use of data for disaster management and climate change, serving as an advisor to the AHA Center for the whole of ASEAN. We've got a lot of moving parts today. This is going to be an interactive session, so you're going to see me moving around quite a bit to help facilitate what we're doing today. I hope you enjoy. Thank you all for joining this, this session, bringing data to life and life to data. Our world runs on data, from streaming services and social media sites that push content to our phones, to the devices that monitor and regulate our health, our smart homes, and even the thermostat in this room that brings us comfort. Data is now as ubiquitous to life as the air we breathe. But is data being used to drive the decisions that matter most to humanity and the future of the planet? In this session, we will explore how PDC is empowering decision makers with data and analytics to save lives, reduce disaster risks, and help communities around the world better prepare for the future that lies ahead. We will explore the importance of making data easy to understand, emotionally compelling, and actionable. And before it's all over, you may even be recruited to support our joint project with the Sunway Center to develop new data to assess planetary health at the national level, so that we may begin to direct meaningful actions and investments that create a healthier planet and a safer world for all.
Right, aloha, everyone. I feel like we have some people over here that have been to Hawaii. So the way that this works is that we say aloha and you say aloha back. So aloha. All right. I thought maybe you were just too tired after lunch. So, but to keep you awake, we actually have giveaways, some of which is Hawaiian chocolate. So yes, you want to pay attention. So today we're going to try and make the session as engaging as possible and do our best to bring some new information to you. So we're going to start. We're going to start with our agenda. So we've got really two main areas that we're going to cover. One is bringing data to life, and the other is bringing life to data. So we're going to get some of your thoughts. We're actually going to start off today doing some Mentimeter questions, having some open discussions. You'll get the opportunity to win prizes. We're going to talk a little bit about Pacific Disaster Center's advanced analytics capabilities. And then we're also going to talk about data for decision making. And we're going to look at a few contexts around the world, some from the Bahamas and Ghana and ASEAN region, and talk about how we're taking data to support action. And then we're going to talk a little bit about the Maui wildfire. I've gotten a lot of questions, so we kind of snuck this one in here. I've had a lot of people ask, if you're not familiar, it's the deadliest U.S. wildfire in the last 100 years, and it happened right by PDC's office. So we're going to talk a little bit about how we did that, how we use data and information within that context. And then we're going to talk about data to empower planetary health. And this is where my colleague Chani was talking about you might get recruited to be part of the first element of the planetary health roadmap, which is measuring planetary health. So we're going to talk a little bit about that. So we're going to start with bringing data to life. Does everybody have their phones with them today? Yeah, who wouldn't, right? So we want to actually get some of your thoughts. So find your phone. This isn't one of those sessions where you have to turn off your phones. All right, you get to use them, but no using them to answer the questions. Like you can't look up on Google answers to questions. All right, we're going to go ahead and move to our first section, which is going to be Mentimeter. So we're going to give you a chance. Let's see. Here you go. So I think they're going to pull up for me the Mentimeter questions, and there will also be a QR code on there. Or you can do menti.com, and you can see the number there, which is 2887-4887. And can we get the Mentimeter up on the screen? They're
Oh.
gonna, oh, thank you. There's the QR code. So we love technology when it works, right? So I can tell all of you have been in that situation before. Is everybody queued up? You're into Mentimeter. We'll give you just another minute. All right, and then we're gonna move into our first set of questions. So anybody who just came in, this is an interactive session. You get to use your phones. Oh, I love all the hearts in there. Thumbs up. Yeah, tell us how you're feeling. All right, we're going to go to the first question. And it's aloha. How are you feeling today? Because one of the things that we discuss is you need to know your audience. I need to know what kind of mood you're in, because I need to know if I should hand out candy first or... So, oh, we've got excellent, happy, excited, a lot of great. Oh, this is a good group. I'm excited to be here as well today. Superb. Now, oh, aloha. Who put the aloha in there? And I've got a prize for somebody who's going to acknowledge they put aloha. Nobody? Oh, that was you? All right, I'm going to toss it to you. You ready? All right. Okay, so excellent. It seems like we've got a good group and you're all happy to be here, which makes me happy. So let's move to the next question. These are a little bit to get you used to doing them, but what is the traditional dance in Hawaii? Any ideas? Wait, which pin?
Oh.
This one. All right. Tango, limbo. We got a lot that said hula. All right. They're copying. You guys are being forced by the crowd. All right. Anybody know what the hula is or able to do the hula? You win a prize. I'm just saying. All right. This lady right here, she gets it. All right. You were the first. Way to go. Okay. Next question. This is our last question on Hawaii, and then we're going to start to get into the real data. You'll be familiar with the system. So what is the official state fish of Hawaii? Oh, they think a lot are mahi-mahi, huh? Ahi, mono, parrotfish. You're very close. You're very close. Okay, the correct answer is not mahi-mahi. No, the correct answer is, and I don't want to say it for you just yet, is number 9, the one that starts with humu. Starts with humu. Anybody willing to try and say the name? Okay, this lady down here in the green. All right, so it's humu humu nuku nuku apawa'a. All right. So, but you get credit for just trying. So excellent job. So now we're going to get into the questions that really matter about data. So no more Hawaii questions. You know how to use the system. Let's go to the next question. Okay, what brought you into this session? Somebody is going to say, I heard there were free gifts. So, which is an okay answer. Data is life. You did. Well, yes, I did drag about 3 people in here, I know. So big data, interesting topic. Closest from lunch. I love the honesty. All right. Anybody who's willing to admit they put closest to lunch up there. All right, this gentleman right here. Okay, good job. Those are all valid reasons, but I hope today that we do start to bring some data to life, that we give you some basic information about data, and we start to connect the dots on how we can bring data together for planetary health. And we've done it in a lot of fields. I know we've got a lot of health workers in here for infectious diseases. You've mastered bringing data together to inform those decisions. PDC is focused on data for decision makings in major disaster operations, but you've also done that in your daily life. You use Waze. Should I take the highway? Should I take the back road? Should I take public transportation, right? Data informs every decision that we make. So we're going to talk a little bit about that today. Next question. Ooh, voting was still in progress. So I'm not sure what this means, Chani. Okay, so first, what do you love about data? And believe it or not, my eyesight is not that good, so I'm going to have to go over here to see these questions. So what's coming in first, Fadli?
Still updating, so very good. Data empowers data-driven decisions.
All right.
First,
And the third one is data reveals what works. Data makes you agile and proactive, and some people don't love data. Who's answered that?
Oh, okay, she gets something. We're gonna make her love
Okay,
data.
sure.
Make her love data.
Make-
So
yeah,
let-
I
you
got it. I
one of
got it.
those? All right. Data should be fun. Data should help us make decisions, and we shouldn't fear data. We should also not overuse data. So we're going to talk a little bit about that. Okay, let's go to the next question. Which one is that?
She will get live Pono.
Oh,
Perhaps you should-
live Pono.
Live Pono. Oh,
Okay,
yes, sorry.
so Pono in Hawaii means to do the right thing. So you want to live right, you want to live good, you want to follow data. All right. But that's very planetary health. We want to live Pono and Malama Aina, which means to take care of the earth. So, okay, the next question is, what frustrates you the most about the use of data? Not knowing if you can trust the data, poor data quality. Yeah, that's tough. Too much data. Data doesn't, what does it say?
Data doesn't equal insight.
Oh yeah, that's one. And then you just love data, right? Nothing frustrates you about data. You just love it.
Okay.
Okay, what do we
Poor data quality. That's the
Yes. And this is a challenge that we have in every single aspect of our life even. How many people have relied on ways to get from point A to point B only to find out that there was an accident and you got delayed an extra 20 or 30 minutes, right? Bad decision because the data wasn't good. So, okay, with that, we're going to come back to this throughout the session, but we're going to go ahead and return to our PowerPoint. Yes.
Oh,
Oh, that's great. Okay.
I'll give
Yeah,
it
he gets,
here for you.
yeah.
Thank you.
Not having access to the data. That is a really good one. Okay. Now I have to make sure I'm going to have to pace Fadli because we're going to run out of goodies because he will give
Don't
out
worry.
the farm for sure. Okay, we're going to talk now a little bit about advanced analytics and what we're doing at PDC and PDC's analytics lab. So for us, we always say data is queen. Data is the thing that we need, but it needs to be good data. It needs to be clean data. And many times we either don't have access to the data or the data quality is poor or there are gaps in the data. So how do we deal with that? And we're doing it in a couple ways. We're using processing and advanced analysis. We're using machine learning to fill data gaps. We're also working to make sure that that data really is enhanced visually so that you can support communication. And we're going to give you examples of that throughout today's session. I'm going to start first globally. And one of the things that we need to think about for planetary health is data at a global or local level, right? It's a global problem. So we have to have data that addresses all areas. And yet the decisions are made at a local level, including the communication of that, which makes this very complex and very hard to do. But we have some examples of how it's done well. So one of the things that PDC did, we started 20 some years ago doing an annual risk and vulnerability assessment. And that looked at different exposures to hazards, including some that are health related. We also looked at the social and cultural environments or the vulnerabilities within those areas and the coping capacities. Now, the good thing is that planetary health includes disasters. It also includes things like health structure, health care, health infrastructure, but it also has to do with governance, right? So a lot of this data actually exists from a variety of partners around the world. We just need to figure out what question we're going to answer. But we can also do it at a regional level. So once you get global data, you can start looking regionally and break data down. And that's something that we're going to have to do for planetary health, because regional organizations can drive decision-making, like ASEAN, or in the Caribbean, maybe that is SEDIMA or CEPRDNAC or CENIPRED in other areas around the world. So we want to make sure that when we're looking at data, we're looking at it regionally as well. And that's the next step down from looking at it at the global level. And what you're looking at here is PDC's climate analysis for each region around the world for 2050. And one of the reasons we do that is because I don't know about you, I want to be alive in 2050, but anything that we build today is in the normal lifespan of that building between now and 2050. So if we're not thinking about that, then we're probably placing ourselves or that building or that structure or that environment in harm, right? So we want to keep those in consideration. Oh, hold on. But we also know that having it regionally doesn't give us everything. We need more detail. I need to know what's impacted. So here's a look at regionally how many people by 2050 are going to be impacted by extreme temperatures. That's over 95 degrees Fahrenheit. For over a month, extended heat, what that might look like economically, and what about your critical infrastructure? Here, we're looking at airports, seaports, hospitals, schools, and emergency operation centers, but that critical infrastructure could be different. It could be clinics. You might want to look at children's hospitals. You might want to look at other areas. To do that, though, and then here's another example that I just wanted to show at a regional level. This is sea level rise for the Caribbean, which is not as impacted by sea level rise as the Pacific. So it's really interesting to look at. But when I share this data with you, it's hard to make decisions, right? A country in the Caribbean could not make a decision on regional data to take action with what we've provided here, which is why you have to go local. Why we have to look at things that matter to them. So part of what we're doing is really looking at things, not only the population and the built-in infrastructure, but the critical elements of infrastructure that they identify. Because if we're going to get people to change, to get involved in disaster management, involved in planetary health, they need to see the change in the vision that they have, not in the vision that we give them, but with their ideas. So working with Grenada, these were their critical infrastructure. They wanted to know about waste management. They wanted to know about fuel terminals and storage, hospitals and clinics, bridges and power plants. But in other countries, this might look very different. So the data that we have at different levels really will impact what's possible. So to do that, PDC actually conducts a program to create the data. And we do that through something that's called the National Disaster Preparedness Baseline Assessment. In my defense, it's an awful name. I know that. I will never do it again. But I thought I was doing it for one country, and now we're at 35, so we're kind of stuck. So we're just referred to this great program with a bad name as baseline assessment. And here, this program actually allows us to create data and information. And we're going to show you a quick video on this that will help shape how the data and information is being used. There's not a community anywhere that is immune to disasters.
Entire streets in Jakarta have been
Category 5
submerged.
storm hitting the Bahamas, heading for the south. One of the strongest Atlantic hurricanes recorded.
7.8 magnitude.
Catastrophe in the South American country of
Hurricane
Colombia.
Eta, one of the most powerful storms to hit Central
Pakistan
America.
is droning. Millions of people are affected.
Spewing clouds of dense
Super
ash.
Typhoon Rai.
One of the country's deadliest typhoons ever. The extreme rains and winds forcing citizens to scramble for
Those
cover.
flames ravaging the historic city of Lahaina, once the capital of the Hawaiian Kingdom.
Is the same thing that communities around the world are facing. Our goal is to make sure that those that have been impacted by disasters around the world have the information they need to get response to them very, very quickly. Everything that we've done here in Hawaii in our own backyard to support my family and the families of everybody that works for PDC, we're also going to do for your family and for the families of our partners in the Bahamas and in Panama and in Indonesia and Palau and Ghana.
Flooding is our number one issue, certainly. That's our number one hazard. We have fires as well. There is more flooding in Ghana now than it used to be 20, 30 years ago. We also have threat of disease epidemics and pest infestation as part of our hazards, but they are not as pronounced as that of floods. Remotely too, we have earthquake threats. Over the years, gathering of data has been very, very challenging, especially when these data centers are started. So what we are doing with the Pacific Disaster Center will go a long way to help us, because already you have your application already, the data that you have trained some of our staffs in. And it is one-stop shop that you can get any data you want, and you can also upload data. And through that, you can be able to get proper perspectives as to what applies to your area. So the project is going to be so beneficial to all of us, especially my organization, not only my organization and our first respondents too, who help us in our disaster management efforts.
We know no bounds, so this is open to all, and our commitment is to early warning for all, data science and technology for all, in an effort to really build these resilient communities. Right now, we have over 33 countries that have participated in the baseline assessment, and that's continuing to grow. So the baseline assessment is more than just an assessment. It's actually a process through which we work with our partners to assess risk, vulnerability, the coping capacity of the community, and work to identify ways that we can better prepare
for disasters and reduce overall losses or impacts if something does happen.
The Pacific Disaster Center has been supporting us with the National Disaster Preparedness Baseline Assessment. This could help us further target areas where we could actually increase the resilience of our member states. When we have information on where these hazards could turn into disaster and what could be the potential impact of these hazards once they become disaster, these are very powerful information that we could actually use so that they could devise ways to mitigate the potential effects of these hazards so that it won't become a disaster. We are not just talking about the short-term effects of a disaster, we are talking about the long-term risk resilience that we would like to implement here in the ASEAN region.
PDC does not do an assessment to a country, we do an assessment with a country. We're sharing ideas, we're sharing lessons learned, and we're amplifying the capabilities in every single one of these countries to be able to build resilient communities in the way it looks to them, in their view.
One of the major hazards we have is hurricane, massive flooding, sea surge. We're in the business of saving lives. So the baseline assessment has been very useful on just about all of the islands. It allows us to make more detailed, specific decision-making as relates to each individual island and not as a whole Bahamas, in the sense that individually the islands now can make preparations as relates to the topography of their land, the flooding, and those specific hazards that will affect their particular island, especially within the hurricane season. In the baseline assessment, a recommendation was made and the government has actually acted upon it. And through that, we do have a merger that we're doing with the help of IDB, so that when we're building, we can build back better. As we move forward within the region and internationally, we would be able to prepare, mitigate, and respond more effectively, so that our recovery could be even more resilient.
PDC is very lucky to have a very strong network of partners, many of which are island nations. We've had the pleasure of working with the best and the brightest of scientists, of researchers, statisticians, the health community, the education community.
That is what this partnership is about with the PDC and projects. It will go a long way to help us strengthen our network and the knowledge, the sharing of information, and looking at best practices.
The first prize goes to Pacific Disaster Center.
The UN Sasakawa Award, PDC won that in 2022, and it's the top award given to agencies and organizations that are doing groundbreaking work to build more resilient communities. So we're really trying to make all of the data and efforts to build a safer world and bring it together in a way that can be operationalized in countries around the world. As we're working in Djibouti and Sierra Leone and Peru and so many other places around the world, the data and information can immediately be used to support all of the decision making and help to prioritize the most life-saving efforts. The opportunity to meet these individuals and to hear their exciting stories and to leverage the work that they're doing, that has been inspiring to me. It's been inspiring to the team, and I think continues to keep us going as we see how much work there is to continue to, protect communities and build that safer world.
Thank you so much. So we mentioned in the video 33, we're actually at 35, and I think we've got even more countries coming. The reason I wanted to share in this session about data and the baseline assessment is because the best data is coming from individuals who are living in that area, right? So data being validated through those individuals that are on the ground is so vital and important. We might have lost them. Oh, there we go. Okay. So we're going to talk a little bit about how that data is being applied. And the one thing that I want to talk about is both quantitative and qualitative data. And I am a social scientist, so I love qualitative data. And all of my partners who are epidemiologists and statisticians, not such a big fan of qualitative data. I want the hard numbers, I want the biomarkers, but here's the reality is that the qualitative data is really what's helping to add context to that quantitative data. So don't ignore it. But let's find a pretty way to present it. Because when you just provide qualitative data in a 20, 30, or 100-page document, nobody is reading it. That we know, right? We're only reading the tweets. And if we're lucky, you might read a Facebook post. But we want a picture and we want quick information. I'm going to be honest, in the United States, I call it comic books for congressmen. So we want to get a quick picture. You want to be able to create and support decision-making as quickly as possible. So as part of this, we have a very quantitative component. So you see up in the blue cell up on the left, that is data and information exchange. And that is between PDC and whoever our partners are. And a lot of times these countries or agencies have worked with organizations who have donated to them a beautiful PDF document of data that they cannot use. And so one of the things that we do is that we digitize that data, and that is really important. So one item I want to advise is if you're working with any partners, make sure you get the actual data. Get it in tabular form, get it in spatial form, but ask that you get the data. Otherwise, you're not going to be able to use that data for other assessments. So we have a push and pull or a give and take kind of relationship with all of our partners. They will give us data that's in bad format. We will clean that data. We'll give it back to them. They get all of the data in tabular and spatial form. We also then work with them to construct a risk and vulnerability assessment. And that risk and vulnerability assessment, as we discussed, will look like their country. So it's not cookie cutter. And then we also do this disaster management analysis, that one in the yellow. Now, this is where I get really excited because I'm the disaster manager and I love the qualitative data. And so you'll see we actually contextualize it through this filter where we're looking at institutional arrangements and enabling environment and, disaster governance mechanisms. And we're producing recommendations in partnership and collaboration with our partners. So that's that dotted line that you see around there. So I'm going to share a little bit with you of what's happening in the Bahamas. And I'm so disappointed because I was really hoping that my good friend Gail Outen-Munker would be here to share what's happening in the Bahamas, but I told her I would do my best to represent it. But the baseline assessment provided information at this scale. Right? Each of the islands, and they had 30 some islands, huge, expansive, network of islands that they have to cover for disaster management, for health, for medical, everything, education. But this data at this scale didn't support each of the family islands making decisions. So they couldn't construct plans. So we actually took it a step further. We might have run out of battery, folks. Oh, there we go. Okay, so what they did is they took it even to the smallest island, Cat Island, which only has 1,400 people on it. But we took the data to a hyper local level where we were able to apply and start to plan for each of the individuals on that island, understand what the economic impact if disasters are going to happen, but also everything down to their shelters. We know which shelters, what their capacity is, and my math is not great, but I know the number of shelters does not match the number of people on that island, right? So how do we plan? This is why data is important. And this is why accurate data is important. And I'll just say one of the innovative ways that on Cat Island they have dealt with this shelter issue is that they actually have equipped caves to evacuate if they have a massive storm. And you might remember they've got, a Category 5 Dorian impacted them. So Then Dorian, here we go, this Cat 5 storm. They were able to use that exact data to create infographics very early on to communicate out to the public who was missing, how many people were missing, but what that meant to their electrical, because they had the data. They knew where each of their electrical hubs were. They knew where their hospitals, all of that data could be mapped, visualized, and easily communicated. And because we had done these assessments, before we even had impact from Dorian, we were able to model with them how much food, water, shelter, refuse was going to be needed in an event. So data is so important because it's life-saving, but we have to have good data. So just to kind of recap a little, we went global. We did that global RVA. Then we did the regional climate change assessment. Then we did these subnational assessments. Now, if we keep going, we're going to have to get always to that hyper-local level based on the decisions that we're making. And this is just an example of some of the exercises. So they're using the data to exercise their plans. And then I want to show a little bit on the qualitative data. So qualitative data, how many people in here are social scientists? Be proud, raise the hands high. You guys are like shrinking, like, please don't let anyone see that I'm a social scientist. Be proud of that one. Okay, so one of the things that we know is we love surveys, right? We love talking to people. We love creating the context. So one of the things that we did was develop this spectrum. It just helps us to understand where these countries sit, what the data is telling us, anything from limited or no capacity in the red to advanced capacity in the green. And this is an example for Ghana on where they sit on their 6 main areas. But we can also drill in deeper to understand what's driving those. So when we look here at enabling environment, we can see that the financial resources and public confidence and support is low, right? So what we've done is for every single one of these assessments that we've done qualitatively, we've linked it to a summary. And we lay it out in this way in a very purposeful way so that you've got the findings, and yes, it has to fit in that box. It's got recommendations for action, but then it's linked directly to the Sendai framework, to the SDGs, to the Paris Agreement, and in this context, also for Africa's programs for action, in the Caribbean for SEDIMAs, in the ASEAN region. And what this allows us to do is measure progress. Are we investing in these recommendations? Is it moving them towards that advanced capacity? And combining the qualitative data with the quantitative data will begin to be able to measure a reduction in vulnerability and an increase in coping capacity. So now you can start to see, are my programs, are my interventions working? I don't know. I'm excited about that. Okay, so data for everyday decision making. I'm actually going to turn this over to my partner in crime up here. Fadli, they've had enough of me, and now it's my turn to give giveaways. So I'm going to turn this over to you.
I think it's not. Okay, there you go. Thank you, Erin. Hi, my name is Fadli. I'm a PDC staff member that working with the AHA Center in Jakarta. Did somebody visit Jakarta before? Did somebody from Indonesia? Okay, there's some of my colleagues here. Thank you very much. But did you visit AHA Center before? Oh, some are visiting. Okay. Oliver, of course.
You don't care.
Okay, so for those who are not familiar with the AHA Center, so it stands for ASEAN Coordinating Center for Humanitarian Assistance on Disaster Management. So we coordinate with the National Disaster Management Organization of those. Now we just have 11 ASEAN member states in responding to major disaster, including occurring in the region. So PDC has supported the AHA Center for a long time in terms of data analytics and the creation of the information products used for the humanitarian assistance in Indonesia. Now I have a little bit question with you. Can you go next? Sorry. Oh, sorry. There we go. Raise your hand if you know, and please mention 11 ASEAN member states.
Okay, any volunteers that want to try?
Oliver? No, I think I will give it to another participant. Can you name 11 ASEAN member states? Just guess it, okay? People in the back, please, sir. Oh. Cambodia, Laos, Vietnam, Brunei, Timor-Leste,
Burma.
What is it?
Burma.
Burma, yeah. Laos, sorry, yeah. Burma,
Singapore.
Singapore, and another one?
Where else? Philippines.
Philippines. Okay, thank you very much. Please make applause to him. Thank you. You're very good in the region. Where you come from, sir? Oh, from Malaysia, definitely. Thank you. So to deliver this, the AHA Center also utilized the system that PDC built, so which is the DMRS, or it stands for the Disaster Monitoring and Response System. Oh, sorry, I didn't click that. So these systems collects data and information related to hazards, early warning, risk, vulnerability, capacity, as well as the data needed to support response activity or pre-disaster activities such as exercise or preparedness. As Erin mentioned, we are working on the National Disaster Preparedness Baseline Assessment, or we call it Baseline Assessment, for 33 or 35 countries right now. So we input all of those information into the DMRS as well. And the DMRS actually is built based on the PDC product is called the Disaster Aware. So this is the example, and we at the PDC produce a variety of informational products derived from the numerous data sets, including hazard information from various sources such as NASA, USGS, or regional organizations like National Weather Service or geological agencies for each ASEAN member states. So our system is integrated with the regional and national level support system for disseminating early warning and coordinating emergency response activities. And we store historical data on natural phenomena such as, tropical cyclones, floods, and earthquake in our database. Now, I have a question again. Which country in Southeast Asia are most at risk from tropical cyclone? Oh, now everybody get the chocolate.
I don't have enough chocolate. Do you have a better question?
No.
You have to have a hard question, Fadli.
Yeah, definitely Philippines. But I want to show you this picture that if you can see that is the track and intensity of the tropical cyclone for a couple, I think around 20 years behind before. And yeah, you're correct. Can you point where is the Philippines? Yeah, it's around there. So Philippines, Taiwan, and Japan also have a high risk on the tropical cyclone, including like in the Pacific, like Palau or other Indo-Pacific nation. So that's why in the AHA Center, the most countries that we are responding to, if you see in here, we have like 43 disaster response activity between 2012 to 2023. So a lot of things happen in the Philippines, and it's responded to tropical cyclone. So this is the example of the disaster-aware product that produce information product about the recent storm in peninsular Malaysia. I think 2 days before that we have what is it, the storms, yeah, in Malaysia and Thailand. So automatically, DMRS produce a product that we refer to as a hazard brief. So this is the hazard brief, example of the hazard brief. Oh, sorry, event brief. This product will display estimates of potential population exposure and the number of the household exposed, which can be stored in adult age groups as well as elderly and children as vulnerable populations. So this product also display critical infrastructure that is exposed, such as airport, seaports, or hospital, or everything that Erin mentioned before in the previous presentation. That all the critical infrastructure that we can see it in our information products. And this is another example of the information products that additionally it also provide estimates of exposed capital assets in terms of monetary valuation. So with this, we can determine the percentage of assets consisting of residential area, service facilities, industrial areas, schools, and hospitals. From total estimated loss overall, we can also see how many are affected by severe or moderate level of damage. Here's an example of the response to the 7.5 magnitude earthquake in Central Sulawesi in 2018, perhaps if you remember. So soon after the earthquake happened, the shake map data is generated. And usually we are taking it from the USGS or our National Geophysical Agency, which is BMKG, and we can produce the impact analysis and assess the potential needs. And we also continue to monitor and collect information from the government, NGOs, and other trusted humanitarian actors, and then compiling it into situational awareness or situational report. If you can see it in the left side, so we compile all the reports from the various organizations, including like UN OCHA or the local IFRC and everything. So another example is a collaborative product between PDC, WFP, and UN OCHA. So currently we call this product JADE, and this collaborative product is matter because we ensure that we are using the same data during the emergency situations. So with this kind of product, this is the example of during the Viet Typhoon Noru in September 2022. So in this example, first thing that PDC runs the tropical cyclone model. If you can see it on the right side, there's a tropical cyclone model, and we publish the result periodically through the situation awareness report, which we can see the estimated wind speed and then the rainfall and also the storm surge. So in the MRS, we also gather the information from various stakeholders, as we said. So for example, here from WFP, they also published the similar analysis in the storm and combining with their own data set, such as estimated calories for food support, and then automatically the tropical cyclone is combined with with our all hazard impact model, and it will produce the impact estimation, including population exposed, capital exposed, and then breakdown of key needs of exposed vulnerable population, and including how many calories per day and how many liters waters per day, how many waste bin do we need during emergency situations, and how many shelter do we need to establish. So we estimate all of this. And then we deliver this to all the humanitarian actors during emergency situation. So often the information will be relayed by the AHA Center through the flash update information. If you visit the AHA Center website, there's a section about the flash update, and you can see some of the example of this product. And it's also there's another example of collaborative product that we usually do during emergency situation. And for the last part is now we do some small experiment in Indonesia. I would like to ask Indonesian people here, do you think how many villages that we have?
That's a good question.
Village. How many villages do we have? Village, desa. No, you don't know? Oh boy. How many villages do Malaysia have? Just guess.
That's worth a really good prize. Like
Okay.
salt lava, or I'm sorry,
You can get
lava
okay.
salt.
I'm gonna give you a clue.
Cups.
I'm gonna give you a clue for Indonesian people or everyone in here. Is it below 50,000? Is it above 60,000? Or it's between 50 to 60,000? 50 to 60? Okay. Anyone else? Above. Okay, so yeah, it's correct. It's around 80,000 village in Indonesia. Perhaps we could give that lady over there a salt.
Salt.
Perhaps Erin could explain what kind of salt is that.
Oh, this is black lava salt from Hawaii. So it's the best.
Okay.
Yeah,
Yes,
for cooking. Yes, when you cook or when you season your food. Yes. We'll give you come see us afterwards. We'll give you recipes.
Thank you. So yeah, Indonesia actually have around 80,000 villages. So recently we've been endeavoring to enhance our data set down to the village level to bolster its resilience. As highlighted in IPCC report, that climate change adaptation at the local level is at the core of the resilience effort. So Indonesia is an archipelagic nation in Southeast Asia, comprising more than 16,000 islands, 99,000 kilometers of coastline, and over 600 ethnicities, and more than 1,000 native language. So perhaps you can you have a question. What does the colors meaning over there? What is the difference between the main island and also we have some group of coloring over there? So we get into that. So if you see here, perhaps some of you already know that we have a downscaled climate change projection information, right? So in Indonesia, so influenced by the unique climate system, Indonesia is exposed to hydrometeorological hazards, which are predicted to increase in the future due to the climate change. So the climate variability is spatially vary within the region. And the microclimates due to contour variation also play a significant role. So it is common that on same day, on one district suffers from flood and the other districts suffer from forest fire. So likewise, the climate projections also vary by region. So this image depicts the expected change in rainfall in different regions. So within 5-kilometer scale, it is downscaled using the RCP 4.5 scenario. And we've experimenting with the data collected by national statistic agencies and try to incorporating it with the climate change projection data. So, oh, sorry. I think I lost. Yeah, okay. Yeah, this one. So as we know that increased temperature, average temperature will produce a larger risk on flood, flash flood, extreme weather, coastal erosion, drought, flash flood, forest and land fire, as well as landslide and high wave. So combining the historical, present, and projected climate data with the landscape information, we can derive the climate and hydrometeorological hazard for each of the village. Sorry. Yeah. So this methodology and tools are still being developed, and we will add more parameters to add more data so we can produce more precise recommendation, and our goal to build the resilience big data. So, and then we do some technique on clustering simple machine learning logic to develop a village clustering with combined hazard, exposure, sensitivity, and adaptive capacity. As you can see in here, you can see the hazard informations and then the adaptive capacity, as well as the, there you go, sorry. Yep. Okay. So the last thing is we have to bring the data to life, right? So what are we doing with those kind of data information? So the last thing that we do is, yeah. So what we do is we do matchmaking the solution. So if you have specific characteristic of the village, including how much the temperature will be increased, how much the precipitation will be increased in the future, what is happening with the farmers for the next couple of 25-15 years projected. So we trying to matchmaking the solution for adaptation. So for example, in one village in Malang Selatan or in South Malang, so if you have a problem that the temperature will increase around 23 degrees, and then, the average temperature is 20 degrees, and in the future, there will be an increase around 1.5 degrees, and then some projected precipitation, and what is the adaptation action of recommendation. So this is the example. If the flood risk increase, then we need to put some community-based early warning system installation. Or for the farmers, they could done some climate field school for rice farmer. And for the urban context, for another example, if we have a urban heat island issues, so what should we do? So we should do, like, for example, building pedestrian infrastructure with shady tree cover or anything that could calm the temperature in the city. So I think that's all for me. I can give it back to you, Erin, and perhaps,
you, Fadli.
yeah.
All right. So, yes. So one of the things that we want to do is provide examples of how the data is being used. But I'm going to ask for some help from my colleague Chani here. I want to take a minute and see at this point what questions you might have. So maybe we'll take 2 or 3 questions if there are any. No, we did such a good job. Or are you guys just afraid you're going to get prizes or asked to do something? Chani, right over here. Yeah. The wonderful woman that didn't love data, but now does.
Yeah, so I'm a science communicator and I work with data scientists. So I'm trying to understand data. I promise I'll get there eventually. But I was wondering, as you said, that kind of tension between qualitative data and hard data, what's it?
Qualitative and quantitative. Yeah.
Do you find that one side or the other has more of an effect in terms of creating action from it? You know, we think about qualitative as being easier to understand personally. Do you find that combination is really important? Is there a balance that you found?
Oh, okay. She deserves a cup for that question. That is an excellent question. So what's interesting is what we've found is that qualitative data is, because it's easier to present, easier to collect consistently, easier to compare across geographies or domains, it tends to be used more, right? But the qualitative data is really the data that helps contextualize what we're seeing in those numbers and why what you're doing is so important, because we need good communicators. And those that analyze data, those that are scientists, are not always good communicators. I know, I'm married to one. So he's very technical, and I think loses the energy and excitement. So it tends to be quality or quantitative data that is driving decision makers. How much, right? You have 10% or 20 or $130 million. But the reality is what's happening around that data, that qualitative component is really important. So I challenge anyone who's got great ideas on how we can better communicate that. And we actually have a session coming up on planetary health and communication on Friday that Oliver is leading, and we have a few people in the audience here that might be on that. That's a good one to come to too. Yeah. Okay, go ahead.
I have a question about the time frame. So you're collecting data, and it will take some time for you to analyze it, and then come to make a decision, right? So along the time frame, data can vary, and from simulation or predictions from existing data at a certain time frame, so it cannot fit the simulation or the idea that this data actually presents. So does PDC, or is there any method available currently that accounts for these variations, and what are the commonly looked parameters or variable on this? Yeah, on the time frame.
Another great question. So understanding the temporal component of data is of the essence, which is why when we started, I was talking about climate change 2050, right? We need to know that I'm not talking 2100 or 2200. The way that PDC has dealt with data is that we do annual updates. So our data is updated on an annual basis, but at the same time, we work with our partners. Jamaica is a great example, or Philippines is an amazing example as well, who, as data is changing, or as buildings are being built, or the demographics of an area are changing, they actually send us new data. So on an annual basis, PDC updates our population models. We update our economic models. We update our global risk and vulnerability assessment models. If something happens in between there, all of our data has what I love to call a birth certificate. For those of you that are, data nerds, your metadata, we call it a birth certificate, but it's going to tell you exactly when it came, where it was born, what we did to it, how we derived it. And so then we update that, and we make sure that every product is date and time stamped, so that you know what decision that you're making off of that. The other thing is that when an event is unfolding, so Fadli shared with you the tropical cyclone, right? That data is extremely related to the timing and the temporal component of it. So that is being updated with every single advisory. Every 6 hours, that data is updated, which means every 6 hours, the projections on the population impacted and the information, that you need to know about who should evacuate, or what's happening, where it's happening, how bad it is, and what I should do about it. That is happening as the advisory is coming in. So there's a lot of other ways to deal with that. I'm happy to discuss that, but I do want to say the temporal component needs to be transparent. Otherwise, you can't make good decisions. Are you a GIS person? Are you a data person? You have to be a data person. No, okay. Yes, we have a question over here.
Yes, thanks for the talk. It's you're not done with it, but it's very interesting so far.
Thank you.
I'm wondering about how do you know what kinds of data could be useful versus what kinds of data are not useful? Like, for example, at the outset, we say don't really know. For example, I come from more healthcare, sustainable healthcare, and then we are trying to understand, it's a very nascent field, and we don't really know whether the we should put resources into developing and trying to get this area of data because it would yield like, this kind of results. And also the kind of people that we should be working with to build a team to, like to crunch that data.
Yeah.
Yeah. So I'm just wondering if you have any kind of ideas. Thanks.
Yeah, so this is very hard. I'll say right now, PDC has over 9,000 data layers that we integrate into the system. And right now we have our team going through a process of removing data, right? Because one of the questions we said, data is not insight. Data can be noise. So one of the ways that we're doing this is PDC doesn't generate the 9,000 data layers. We're doing it through partnerships. Otherwise, we wouldn't be able to sustain it. So that, I think, is number one, is make sure that you've got good partnerships. And then we work with an advisory group. So we work with the regional organizations to identify what types of decisions need to be made. So we work with UNOCHA and World Food Program. What decisions are you making, right? And that's at one level. And then what decisions need to be made at a national level or a local level? And the scale of those decisions will be determined, will determine the type of data that you need. And I will say, sometimes you don't know what question to ask or what data. When I started the baseline assessment in Peru, right, I had one set of questions. I wanted to know the vulnerability, the coping capacity, and the disaster management capability. Today, we amass data that now it was like, oh my gosh, I can start asking questions I didn't even know needed to be asked. So there really is a balance between being a little forward leaning and collecting data you might not know how you're using it today, but to gather it and standardize it and hold on to it. Now, not forever, right? But give yourself a window. But I also want to say, don't ever duplicate efforts. Be friends, right? There's no need. Nobody has enough money or time to duplicate efforts. So share, be friends, and everything that we're showing you today is available to every single person here. So the data, the information, the disaster aware platform, it's free and it's available. And if you're a student or a faculty member, you actually get access to a lot of the data, like direct data. So not only can you do it through the system, but for analysis and support. So work with us. Yeah. I'm going to take one more question, and then we're going to go through a few other things because we've got some Mentimeter questions.
Thank you for the opportunity to ask that last question. If I understood your model correctly, it's actually going through the organizations and trickling down the community. My lived experience of Australian 2019-2020 bushfires as part of the community was actually inability to access any data in terms of being able to understand where the safe evacuation centers are, what's the safe road to evacuate, and so on. So I guess the question comes to two formats. One is, what's actually being done to empower community at individual level to access this amazing data that would actually give them guidance in terms of safe evacuation?
Mm-hmm.
And secondly, when that data is made available and accessible, if you think about it in the context of the global world, how is it actually standardized that we all speak the same language? Thank you.
Great question. So one, we have an app on your phone for mother, brother, sister, anybody who's not in the field of disaster management or, Planetary Health, and it's free. It's a free download, and it provides global coverage. And we work with NASA as one of our main partners. So for floods and landslides, which I know is a big issue here in Malaysia, we're doing predictive analysis. So not just what is happening now, but also predictive, and wildfires included in that. But how to get it to the individual, we're doing it through the phone to that individual. The other thing is in the picture, I don't know how we got on this, but I'm going to just go back one because, sorry, guys. Okay, that picture right there tells the reality of it, which is those are paper maps. Those are paper maps because the technology you use needs to be right for the situation that you're in. And when I was in Tacloban in the Philippines in 2013, we were working on chalkboards and paper, but just because the technology can't be used in that moment in this space because you don't have connectivity, you still need that technology to enable everybody else that's coming in to help. So the way that technology is used in the Maui wildfires, for example, is we couldn't use it in Lahaina at all, but we could use it in the operations center, and we were able to get to the state and the federal and get partners in that way. But the reality is that you're going to be working at the most hyper local level when you're dealing with a response. We're choosing the phone network that doesn't always work. There's limitations on that. And so we do enable our partners when they get the alerts, they can also sound the sirens. So that's a manual piece. So okay, we're going to run out of time, and I got all sorts of good stuff. So what I'm going to do is, Chani, I'd like to, maybe we'll skip over the wildfire and do some of the Mentimeter and get to the planetary health, because I want to maybe rope you in a little. So, oh, okay. So we're back on does everybody still have their Mentimeter working? Can we go to the next question? I see some. Okay. Oh, I'm sorry. Okay. Did you see any of the data? So we got a lot of yeses. All right. So talk to me after for that. Well, let's go to the next question because I know people want to go to some of the other sessions. No, nobody. If you're a no, you need to come see me so we can get your data in there. The next question. Go to the next one. Okay. So what data do you think is the most important for planetary health? Qualitative carbon levels now. That's a good one. And it's also okay to say, I don't know. That's an okay response to say, I really don't know. Shelter numbers, education, local data, action. Oh, air quality, health facilities. I think health facilities definitely. Oh, these are changing so fast. It's hard. Chani, what do you see up there? So SDG. Climate hazards. Yeah, grab one of
Economic.
those. Okay.
Government willingness.
Environmental data, air
Yeah.
quality.
Okay, so we can start working some of those in for sure. All right. Can we go to the next? We're going to move on to the next question. So who is your go-to for planetary health data? All right. Yeah, I don't know either. I think we need to create that. Right? We get pieces of it from IPCC, pieces from, Google, UN, no data. I don't know, not sure. Okay, so this is something we have to change. What does it say? I like that. Who wrote that one? Yeah, that's you. All right. Can you catch? All right. There you go. All right. He got some chocolate for that one. That's good. But I think, we've got members of the board in here on the Planetary Health Alliance. That seems like an action that needs to be taken. We need to be able to tell people where to find the data to be able to make those decisions. So next slide. Okay, so have all of you seen the action plan? You've seen the roadmap? I'm curious, which action on the planetary health roadmap can you help support? Is it measuring planetary health, communicating planetary health, bringing or educating to achieve the global transition? What else do we have up there, Fadli? I can't, building holistic governance.
Yeah, balancing business and mainstreaming.
All right. So who are the three? Raise your hand if you're one of the three that are measuring planetary health. Did you select that? Okay, here you go. So we're gonna Now everybody's going to start to put theirs in there. There were three. I just want to be clear. Okay. So if you were on the measuring planetary health, I know this gentleman right here. Did you get one? Did you? All right. That's two. Did you get all three? Who was the third person? Did you?
Oh, after.
All right. Okay. So the three of you, we're going to talk after this because you're going to be part of the solution as we advance towards understanding planetary health. So can we go back to the PowerPoint slide for a minute? And I want to take you to the last set and then we've got a few minutes. Okay. Keep going down. Okay. Go to 57 or 58. Yeah. Okay. Data for empowering planetary health. So this is your roadmap. So I think most of you have seen this, right? And the first one is measuring that planetary health. And we need to first identify what data we need, which is why I wanted you in this room, which is why I'm interested in what you're doing and how you're working with that, because this first piece is going to help guide all the other sections. We can't effectively communicate it if we can't measure it and we don't know what it is and we can't define it. So that is the first piece. So to do that, next slide. Oh, I guess I can do that. It's not. All right, thanks. So the next one is to move forward with a 2024 planetary health assessment. So PDC and the Sunway Center for Planetary Health will be conducting this year, 2024. So our friends who asked the question about the temporal component of data, you keep your eyes open for 2024, okay? Because we're going to have an assessment and it's going to be a composite index. Right now, we're conceptualizing it as a composite index that will be at the national level. So we're going to start national, then move regional, then move local. But the idea behind this is that we're going to need different perspectives. We're going to need to identify the data. We're going to need to standardize the data. And then we have to get the data in your hands because the actions for planetary health are not happening by PDC. We're an enabling force. We are the ones that are enabling the decision making. We're enabling our partners to take the right action. So that's what we're hoping to do and hoping to facilitate and take all the lessons learned from disaster management and be able to share that as part, not as all, but as part of this planetary health effort. So with that, I'm going to take any last questions because I know the session is going to run out. So do we have any last questions? Oh, yes.
Yeah, I would like to ask basically, how do you test, validate, and develop your models?
Oh, thank you so much. So when I first started, I talked about our analytics lab. We have a dedicated team who are testing, who are not only, first they're validating data that's coming in, cleaning and standardizing data. And then what their mission is to work with our partners to validate. So part of the data that you see on the population impacted and the economic impact and the how much food, water, shelter, that comes from a model PDC created, which is called the All Hazards Impact Model. And we took 3 years validating that with World Food Program, UN OCHA, and IFRC. And we use that actively to refine it. And then each year, that model, the underlying data is updated, as well as validated or calibrated, I should say, based on either the data, the events of that year, and the newest projections moving forward for climate change. And if you want more information than that, I'm going to get you in touch with Dr. Joseph Green. All right, because I want to say just enough not to get myself in trouble. Yes, that was a good one. Any other questions? No? All right, well, I want to thank you all for coming here today, for spending your time, for hopefully winning a prize and and spread the word on what's coming for Planetary Health, because it will take a collective effort on our data and our understanding. So I look forward to seeing you throughout the rest of the week. Aloha.